can go ahead. Thank you.
Okay, so I'd like to welcome you all for this webinar on nutrition and hope I'm audible to all. And today we are going to discuss some of the very important topic, and that is how nutrition is important for us. And to begin with, first I'd like to tell you all that in this module, we are going to cover the incidence and prevalence of nutritional deficiencies in South Asia and in India. And we'll also talk about the importance of vitamins and micronutrients, how they affect our daily functioning. Then the most important thing which we will discuss is regarding how you can get these micronutrients and nutrients and the vitamins in your daily life from the whatever you intake, whatever you take in your diet. How can you supplement through dietary advices, and what are the lifestyle factors that will increase the micronutrient demand? So first, let's look at the statistics. What the statistics talk about the energy supply in the seven South Asian countries, and if we look at the deficiencies, there is India has got the highest prevalence of inadequacy of vitamin B12 and zinc. You know, vitamin B12 is mostly found in non-veg products, since most people are, some of the people, large section of people are vegetarians, so they will lack vitamin B12. So whenever such patients come to our clinic with history of like not taking proper non-veg diet, then we should definitely supplement vitamin B12. And India ranks among top three countries to have the potential for inadequate intake of vitamin A, riboflavin, vitamin B12, and calcium. So these intakes, these vitamins, we are grossly deficient or inadequate. If you look at the ICMR data, about 32 to 41% of adults meet 70% more than 70% of recommended dietary allowance. Higher risk of dietary inadequacy for folate among adult women of reproductive age, that is 20 to 49 weeks of pregnancy. Uh, if the women hasn't received folic acid, then after giving folic acid after 6 weeks won't help much, because the open neural tube defect remain persistent all through the pregnancy. So if you want to prevent the neural tube defects in baby, then you should start folic acid supplementation whenever mm, the couple start planning for pregnancy. Like pre-conceptional folic acid should be given to all those who are expecting, who are planning for pregnancy. Then the urban population reported to have 13 to 18% of adult consume less than 50% of total folate recommended dietary allowance. And if we look on the recent publication which was published in 2018, that Indian population reported the risk of micronutrient inadequacy in 62% of the population, most likely to have vitamin A, B2, C, and zinc inadequacies. And the inadequacy of zinc was 89% higher in the 60% 60 year age group. And you should also know that zinc is very important in terms of NCDs. There's more prevalence of NCDs like diabetes, hypertension in the older age group. Frailties, they are much more deficient in zinc. Then the next thing, the prevalence of inadequate micronutrient intake in Indian population at risk of deficiency was 94%, vitamin A is 89%, vitamin B12 82 and 81%. And this is the predicted is there, but the population will increase. So if we look at the total number, then there will be significant large population which will be at risk of micronutrient deficiency in the coming years. So we need to think very clearly in these terms. Now coming to prevalence of inadequate vitamin B12 and zinc in Indian population. There is a study reported that only 26% of Indian population was vitamin B12 sufficient, if level 2 between 200 to 300 were considered deficient. Vitamin B12, as I told you before, the main source is in non-veg. and many people being vegetarians, they will lack vitamin B12. So, one of the most important thing what we need to consider among vitamin B12 that we should definitely deworm everyone. Deworming is very much important, not only for vitamin uh, iron deficiency, but also for all kind of micronutrient deficiencies. If you want to uh, reduce the prevalence of micronutrient deficiency, then we should first do the deworming. It's very important. Then those who are vegetarians, they should be given vitamin B12 supplementation is very important. Zinc, the inadequate zinc intake in India has risen from 17.1% to 24.6% over the span of 3 decades. And so you should check that what happened in the last 3 decades, how our diet pattern has changed in the last 3 decades. Whether our consumption of green leafy vegetables and zinc rich foods, how it has decreased. Now we have started consuming much and much more fast foods and um, like uh, whether the food sources which you are consuming is fresh or not, and that our timing of meals, plus prevalence of other diseases in our society. So these all things determine why the inadequacy has increased over the last 3 decades. Intake of micronutrients as per RDA is very important to prevent the symptoms of deficiencies. We should also think parallelly in terms of growing prevalence of diabetes, hypertension in India, vis-a-vis the deficiency of micronutrients, because they somehow also influence our non-communicable diseases like diabetes and hypertension. Diabetes has grown multiple times in this last decade, and we should think really in these terms that whether they have got any role in this or not. Lower consumption of vitamin B12 was observed. Females consumed less nutrients in other diet as compared to male. Intake of copper, iron, magnesium, selenium, and zinc was lower in females compared to males. The need of micronutrients in women of reproductive age group. Nutritional deficiencies among women of reproductive age have transgenerational consequences. Adverse birth outcome, poor perinatal survival, altered development in offspring. One of the most important thing which we need to consider is folic acid. Folic acid is very important during pregnancy, even in pre-conception. Whenever you start thinking of to have babies, you should give folic acid. Importance of micronutrient status during reproductive ages of women. Maintenance of optimal nutritional status throughout the reproductive years is essential in women. Women of reproductive age in low and middle countries may face a serious health problems. For fetal and embryo development depends on nutritional status of the mother, and supply and availability of micronutrients is important in these women. Sometimes we measure DSH in pregnancy to check the growth of fetal brain is there or not. But all these hormones like thyroid hormone, sugar, everything is influenced by these micronutrients. And we should also think in these terms also whether the diet habits of the in pregnant ladies or in general is there anything deficient, is there anything inadequate, and how we can supplement those things. We should carefully look at the whatever whatever patient or normal person is taking in the diet, whatever things which is lacking, whether diet is proper or not. This will give an important clue to the diagnosis. So, status of dietary intake against RDA in women of reproductive age in India. This is a very important study which was very recently published in 2020, and it shows that 30% of adolescent girls and lactating mothers consume less than 50% of recommended intake of energy. The consumption of energy, proteins, zinc, and vitamin C was the highest among women from Bangalore compared to women from other districts, and it was very significant. P value was less than 0.001. The iron and vitamin C intake were the least among residents of Patna. The study identified decrease in the energy, folic acid, and zinc during pregnancy. So, whenever such patients come to our clinic, visit us for any problem, we should definitely take the advantage to correct these nutritional deficiencies also. So, RDA, what we need to know, RDA is something daily dietary nutrient intake level that is sufficient to meet the nutrient requirements of healthy individual in particular life stage and gender groups. It is obtained with consideration of food metrics, effects, and losses during cooking. Risk of toxicity is unlikely on the extended intake of RDA levels. So, this is the chart which show that this daily diet fulfills our RDA requirement. This is the average diet which we normally consume. And our if we look at the micronutrient zinc, uh, in among men and women, we have seen that zinc, vitamin B2, B3, vitamin B12, we haven't achieved enough through our normal diets because there is lack of green leafy vegetables, uh, chicken, fish, egg, or fresh lentils, pulses. So these things are inadequate in our diet. That could be the allowance through our normal diet. So only 70% of our micronutrient need is fulfilled by our Indian diet. An overwhelming 85% of our doctors and nutritionists from urban India believe so. And this is the HCV survey by Brand Ellison. And the next thing, which is more important, that there's need to increase the intake of B complex vitamin beyond the RD after exercise. The number of certain micronutrients lost during sweating and intake may need to be increased to meet the RD while living and working in a hot environment. Vitamin B12 is the only B vitamin not found in vegetables, and that's very important. If someone is diabetic and taking metformin, then they are also prone to develop vitamin B12 deficiencies. So, in general, if someone is diabetic and taking metformin, is vegetarian, then definitely he's going to be deficient of vitamin B12. So, there is the need to supplement vitamin B12. A daily intake of zinc is required to maintain a steady state because the body has no specialized zinc storage system, whereas there is storage system for vitamin B12. Micronutrients are not produced in the body and must be derived from the diet. So a diet be such that it contains equal amount of vitamins, minerals to support our daily needs. So vitamins and minerals, they have got some very critical important role in our life. Vitamins are essential for structure of skin, bone, nerves, eye, brain, blood, and mucous membranes. Similar goes for minerals, and these are uh, some of the important things which have been highlighted in this thing. Zinc is part of coenzymes in many important functions of our body, and vitamin B12 is required for fat and carbohydrate metabolism as well as for protein metabolism. Magnesium was required by all ATP involved enzymatic reactions. L-glutamic acid leads to alanine synthesis in muscle metabolism and its key player in nitrogen metabolism. Vitamin C is essential for the synthesis of creatine, carnitine, catecholamines, and adrenaline and non-adrenaline. Folic acid is definitely required for DNA synthesis. Uh, One more thing is important, that absorption of iron is also facilitated by vitamin C. So if you are giving vitamin iron supplements and the patient is also taking vitamin C, then it will help iron absorption. But if you are giving iron and also giving calcium, then both may hinder the absorption. So we should always make sure that whenever we are giving iron supplementation, we should never give calcium supplementation at the same time. We should keep some gap. So micronutrients play essential role in every state of energy metabolism during cellular respiration. The B complex vitamins are essential for mitochondrial function, and lack of just one of these vitamins may compromise an entire sequence of biochemical reaction necessary for transforming blood into physiological energies. So, role of micronutrients in immunity. This is some of the most common question patients now ask, that what are the things which I can take to improve my immunity? Look, there is no shortcut and there is no drug which can directly improve your immunity. It's something, it takes time and it's a complex process, and there's no drug, there's no magic which can directly improve your immunity. It depends on various factors, but these micronutrients had definite role in improving your immunity, like vitamin A, D, E, C, B6, B12, folate, zincs. It's improve your the normal cell functioning. Uh, Antioxidants, vitamin A, D, E, C. These are some of the important vitamins which not only improves your immunity but it also goes in inflammatory response, adaptive immunity, T cell proliferation, antibody formations. So these all together works towards your quality of life. If you have got these in good amount in your body, then you won't develop any disease very easily. You won't have many kind of allergies. It will also reduce. It will also improve the healing time. Suppose you get an infection, then you'll recover very quickly when you have got the proper amount of these micronutrients. So, and we should also know about the synergistic effect of zinc, vitamin C, and vitamin D on immunity. Zinc improves T lymphocyte proliferation and function. Vitamin D improves immune cell function and cytokine production. And vitamin C acts as an effective antioxidant and stimulates white WBC formation, including lymphocytosis and neutrophils. So all together have got a very important synergistic actions, and they act as for skin and mucosal barriers, white blood cells, and antibodies formation. And it definitely reduces the risk of acute respiratory illnesses and influenza. That's why many companies have come up during the COVID times with vitamin C supplementation, vitamin D supplementation, zinc. And we don't know that how much it directly affects in COVID or any other illnesses, but it definitely helps you to improve your body functioning. Selenium is to enhance immune function, optimum selenium status, enhanced T cell proliferation, natural killer cell activity, innate immune cell functions, and deficiency or insufficiency it reduces immunity and increases inflammation. So selenium deficiencies definitely can give rise to immune incompetency and increase susceptibility to infections. And they have got very critical roles in blood cell formations. Folic acid deficiencies and vitamin B12 deficiencies are known to cause megaloblastic anemia because they are required for normal erythrocyte production. Pyridoxine, vitamin B6, contributes to heme biosynthesis. Folic acid is definitely required, and folic acid is very important if the patient is on some rheumatological drugs like methotrexate. He should definitely supplement methotrexate, or he's on anti-epileptic medication. Then also they require folic acid. Vitamin D is very important, contributes to normal cell division, influences the action. Magnesium maintains cellular membrane stability. My postgraduate thesis was on magnesium and the effect of magnesium on diabetes. Who are magnesium deficient, they are much more prone to develop diabetes microvascular complications like diabetes retinopathy, neuropathy, and these retinopathies. Zinc helps in normal cell division. There is important role of zinc when we talk about diarrhea in children. Zinc supplementation for 2 weeks is very important in pediatric diarrheas, and we should not miss. If any younger kids come with diarrhea, then we should definitely supplement with zinc. So lifestyle factors that increases micronutrients demand. So there are different lifestyle factors. One of the important is erratic lifestyle. We are not taking meals at proper intervals. Hectic, stressful lifestyle, sedentary, reduced intake, pollution, smoking, stress, sleep deprivation, excessive alcohol consumption, prolonged excessive exercise. These everything leads to impaired immune function and increased risk of infection. So lifestyle factors like it leads to fatigue, tiredness, impaired immunity may result due to lifestyle factors, rushed meals, unhealthy diet, chronic dieting, smoking, excessive alcohol, and micronutrients levels in our body. So the requirement of micronutrients increases during the course of lifespan. Like in elderly, we talked about there's increased demand of zinc, calcium, and vitamin D. In the menopausal women, after 45 to 50s, we see there is increased risk of fractures because of post-menopausal osteoporosis more there. So it requires magnesium, zinc, calcium, vitamin D. In middle age, family and occupational stress, there's increased demand of folate, vitamin B12, D, and minerals. In the growing age, there is increased demand of vitamin B, C, and D. So these several vitamins and trace elements have got a very important role in supporting the immune system throughout our lifespan. So effect of suboptimal micronutrient status on our health. Suboptimal micronutrient status below RDA disrupt homeostatic processes essential in maintaining good health. So if there will be suboptimal micronutrient status, it will differ pathways and immune function and finally lead to a reduced health status. So impact of inadequate micronutrients across lifespan. If there is inadequate vitamin and mineral status, in babies there is increased risk of LBW, higher mortality rate, impaired mental development, increased risk of chronic diseases. In child, stunting, reduced mental capacity, frequent infections. Adolescents, stunted, reduced mental capacity, fatigue. Among the adults, there's increased morbidity and mortality, reduced productivity, poor socioeconomic status, and these everything are interlinked altogether. So when health is equal to energy into immunity, an adequate intake of micronutrients necessary for optimal energy production, adequate level of micronutrients helps in the recovery process in cases of infection. So now the question comes that where our patients can get. So in general, all these vitamins, they should take fortified milk. These have got essential amounts of vitamins and minerals. In vegetables like carrots, sweet potatoes, and squash, mangoes, vitamin A is there. Similar goes for different kind of vitamin B. It's there in all kinds of non-veg products like eggs, meats, chocolates, um, poultry, pork, fortified foods. But one thing most important to note is that vitamin B12 is only found in the non-vegetarian sources. There is no such veg source where you could get a vitamin B12. Rest in general, if you are consuming good amount of fruits, green leafy vegetables, pulses, then and obviously you are taking eggs, chicken, fish, then there is way less chance that you will be inadequate of these essential vitamins. Vitamin D is only a sunshine vitamin, but it's hard to get vitamin D from food alone. But if you're thinking in terms of food where you can get, these are fatty fish, egg yolks, liver, mushroom, fortified milk has come there. Then vitamin E and is there. Vitamin E is very important because most of our patient comes with cramps and there we prescribe vitamin E, and we can just also advise them to take more of green leafy vegetables, oils. It's present in wheat germ oil, safflower, sunflower oil, soybean oils, pumpkin seeds, sunflower seeds. Very good source of vitamin E. Vitamin K is very important in cases of those patients whom we are prescribing some anticoagulants, like the patients of atrial fibrillation whom we prescribe anticoagulants, because vitamin K helps in coagulation. And if we are prescribing anticoagulants, then these are something which we should be careful about, like broccoli, cabbage, green leafy vegetables like kale, spinach. These have got very good amount of vitamin K, and that may interfere with your anticoagulants. If it then if you talk about the minerals, calcium is milk and milk products are very good source of calcium. Fluoride is important for our teeth. It's found in seafood, coffee, and tea. Magnesium is there in whole grains, most of the fruits, dark chocolates, seeds, peas, and legumes. Phosphorus is there in pork, poultry, eggs, and organ meats. Sodium is there in our carrots, radishes, sweet potatoes, potassium. Potassium is equally important when we talk about our kidney patients whom potassium is high, and we ask them to avoid certain foods. Like we should avoid them to don't take bananas, don't take grapes, avoid nariyal pani, coconut water, carrots, beets, and turnip because they are good sources of potassium. So those who are hyperkalemic, then we should avoid these food sources. Veg and you're taking whole grains and dairy foods, then you won't be deficient of zinc. Similar goes for selenium, iron. Most of our women are deficient in iron. So these are some of the very important things which we should definitely in our OPD convey to our patient that they should take good amount of green leafy vegetables. Spinach is very good source. Red meat, fortified breakfast cereals, oysters, dark chocolate, soya beans, lentils, tofu is very good source of iron. Manganese, soya beans and soya foods, chickpeas are very good source of manganese. Iodine, mostly we are not very deficient in iodine because iodine we consume iodine in our salt. It's already fortified. Sulfur is there if you're consuming non-veg, then obviously you'll get enough sulfur in that. So this all from this module, and micronutrient deficiency is highly prevalent in India. Effect of micronutrient deficiencies leads to tiredness, susceptibility to infections, increases demand for micronutrients. Insufficient micronutrient consumption via daily Indian diet, one of the main regions of micronutrient deficiencies. And recent survey shows that only up to 70% of our micronutrient need is fulfilled by our daily Indian diet. Specific micronutrients like zinc, vitamin C, and D amongst plays important role in delivering energy and enhancing immunity. And it's important to bridge the micronutrient gap in the daily diet, thus building long-term energy and immunity. Thank you.
Thank you very much, sir. First of all, sir, thank you very much for accepting this scientific session and being a part of a speaker from Diet side. One last question is for all participants regarding this presentation. First of all, sir, thank you for such a nice presentation, and you have elaborated the things very nicely, and it's a very understandable also. So all the participants, this is my request to you. If you are having any queries, any question related to this, nutrition part, you are welcome.
So, thank you everyone, and I'd like to thank you, like Gobit who has joined from Sri Lanka this meeting. And next week we'll have another webinar on some different topics related to diabetes, and I'll inform you all. So thank you for joining, and if you have got any questions, you're please free to message or call me back. Thank you.
So I think, sir, there is no question from participant side. So